We are focusing on the battle against weight. So many people have tried diet after diet, but they fail to find long-term success. Losing weight isn't just about appearances. It's about your overall health. And today, my guest can explain a program that can get you fit and trim for life. Dr. Therese Stubbs joins me from Therese Aesthetic Medicine. Doctor, nice to have you back again.
Nice to be back.
Usually we're talking to you about aesthetic medicine, you know, making our skin, our face, everything look a little better with the help of lasers and things. And how did you get involved in the weight loss part?
Well, nothing boosts someone's self-esteem more than losing the pounds they want to lose. And we first got into this because people were presenting for Smart Lipo, and they weren't candidates yet because they had more weight to lose before they were an ideal candidate for the lipo procedure. And it really became clear to me that a lot of patients didn't know how to eat appropriately. And so the Fit Trim Life program that we've devised combines a low glycemic diet with patients who qualify can get a prescription medication. The prescription medication can decrease their appetite and increase their basal metabolic rate, so they're burning more calories on a daily basis. But the big push is not to be dependent on this medication for life. It's teaching them how to eat the right things for the rest of their life. So it's kind of a lifestyle change.
What is glycemic index then, and how does that have to do with all of this?
The glycemic index of a food is how quickly and how much it will raise your blood sugar. So if somebody eats even a piece of fruit and hasn't eaten for a long period of time, that will shoot the blood sugar up, and then the body produces insulin. Insulin is a fat-producing compound, so insulin gets secreted, and what does insulin do? It packs on the pounds right around the middle. So the more someone's blood sugar is going up, down, all day, the more insulin they're secreting, and they're putting on weight typically right around the middle. So if you can even out that blood sugar all day by choosing the right things to eat, then you can reset your insulin clock, for lack of a better term, and you can decrease the weight right around the middle by eating just as much of what you want, but
it's how what you eat it with many times.
Exactly, and that's the education process.
So if you bring in someone, you educate them, and they start eating, what qualifies them then to go to the prescription drug route for some folks?
Well, basically, if somebody's BMI or body mass index is greater than 30, then that qualifies them under the Medical Board of Ohio regulates this drug very, very closely, which is a good thing. It's not something we ever want people to become dependent on. But for a 12-week period of time, they're closely monitored. If their BMI is greater than 30, we put them on this drug. And if they have no cardiac problems, we do a set of lab work, an EKG, and a physical exam, and a thorough medical history. And then if they're qualified to be on this drug, we see them every week, and we test their blood pressure, we weigh them in, and it can be just that little boost they need to start to see that scale move. And we've had patients lose 7 and 10 pounds in the first week.
Wow,
they're in tears
impressive.
In the office, just so happy that the scale's finally moving. And when that happens too, they're more motivated to eat the way we're telling them to eat, and they see the results faster.
If you see changes, you're going to know that yes, it's working, and you keep on working. And I think the important thing is that these folks are going to do it with your help, a doctor's help, and you can watch them along the way.
Exactly, and a lot of people too, when they're done with the weight loss program, they know how to eat the rest of their lives. And I think somebody mentioned earlier that everybody falls off the wagon. Everybody has the Christmas time, the holidays, the summer where they indulge in a little or ice cream day. And then you have to get back on the wagon. So it teaches folks how to go back to that first phase of the diet where they reset that insulin clock and they can get the weight back off, even if they do have a slip of 5 or 10.
So it'll last. You can still do this, and as you said, it's a lifestyle change.
It is. It's learning how to eat for life.
So they've eaten for life, and they still have a little punch.
And that's where Smart Lipo comes in. That's right. That's where the laser lipo.
Sometimes after babies, it's just still there.
It is, and there's a lot of times hormonal changes. We'll check people's thyroid too. A lot of times, gals after having a baby, their thyroid's a little bit off, or there's other hormonal changes, and then making sure that there's nothing else going on causing them to be unable to lose weight.
So would someone come to see you for a consultation then to decide what's the best route for them to take?
Exactly. We do a thorough consultation with the first meeting. They step on a scale that gives us their body mass index, and it's pretty much a cool tool for telling people how much water weight they have, how much body fat weight they have. It's a great little machine. Even tells you which arm has more muscle mass, which leg has more muscle mass. It's a very cool tool to kind of give somebody a printout and say this is where you are today, and then we do it again at about 6 and 12 weeks, and they see the weight fall, they see the body fat fall, and they see the muscle mass increase.
And the machine doesn't lie.
It doesn't lie.
You have a promotion for our daytime viewers?
We do. For 10% off any service we do if they mention the Gail Hogan Show. So that includes their Botox, their Restylane, their Smart Lipo, 10% off anything if they mention they saw us on Gail Hogan.
Thank you very much, Dr. A. Nice to have you here.
Nice to be back.